Good. All right, we want to toss into Casey, and Casey, you have some good advice for us today too.
Yeah, we're talking about thyroid problems. We're here with Dr. Joshua Red from the RedRiver Functional Endocrinology, and we're talking about the thyroid and how it affects you. And I'm going to be honest, what I know about the thyroid is a lot of people blame it for very bad living situations, and it seems to affect a lot of stuff, right, doctor?
Exactly, yeah. I mean, just to give you an idea of how important the thyroid is, every single cell in your body has a thyroid hormone receptor. And so, I mean, it can affect anything.
What kind of things can it affect? What kind of moods will it be putting us in?
A lot of my patients, they'll have a very poor quality of life. They'll be depressed, they'll be fatigued, they can't lose weight even if they try. They'll lose their hair, they have cold sensitivities, all that type of stuff.
And the average approach to that is throwing what at it?
Basically, in the medical model, they'll prescribe you with a hormone replacement, and that's how you'll be treated for the rest of your life. That's it.
But you guys do something different.
Absolutely.
What are we doing?
I mean, basically, the majority of these patients suffer from what's called Hashimoto's, which is an autoimmune disease that actually attacks the thyroid. And these patients will have an awful quality of life. And so what we'll do is we'll figure out what's causing the Hashimoto's to increase and attack the thyroid, and that could be multiple triggers. That could be poor liver function, that could be poor adrenal gland dysfunction, that could be cortisol defects, that could be adrenal gland dysfunction, that could be blood-brain barrier problems and intestinal permeability problems. I mean, there's a lot of different things that cause this. You can't just do one thing and expect to get results.
Now, we brought Breianne because she's been a patient of yours for how long?
She's been a patient of mine for about 3 months now.
Okay, and before you came to Dr. Red, what has been going on?
Gosh, I was just poor quality of life for 2 years. I had been to 7 different doctors, and they did put me on the hormone replacement for the thyroid. And after a year, so they had to up it. And I guess that's what they usually do, is if they don't see results, they'll usually keep upping it. And then I went to Dr. Red, and he started me on this program, and my quality of life is
what are some of the results
better
that you noticed?
I couldn't lose weight before. I've lost 25 pounds in the last 2 months, and I'm able to get up each day and be able to function normally and exercise and do the things that I want to now.
So if someone's back home watching this right now wondering if they should give you a call, if they qualify, if they can be helped by you, what are some of the things they should be asking themselves?
Well, I mean, think about how many good days you have of the month. I mean, literally, like, a lot of our patients, they'll have like 0 to 5 good days out of the month, and that's it. I mean, it's awful. Many of our patients have a very poor quality of life. It's very, very frustrating. And they go from doctor to doctor to doctor, not getting any help because no doctor is actually figuring out what's causing the disease. They're just doing these basic tests. Here's your pill, and out the door. And even on the alternative medicine, like how these alternative doctors give you like the purest form of selenium or like iodine, and like if you do that, that might actually make these patients a heck of a lot worse as well. So.
All right, so they should give you a call, and the phone number is?
It's 801-446-2822.
And you guys are located where?
We're in South Jordan, Utah.
All right, go check him out. It's Dr. Joshua Red from the RedRiver Functional Endocrinology, and thank you very much for stopping by. And here's a picture of what's going on for your weekend.